Let's get straight into the day's big news, and the Ministry of Health has dispelled fears that close to 8 billion Kenya shillings could have been misappropriated during the fight against the COVID-19 pandemic by the haphazard purchase of vaccines without regard for procedures. Now, Health Principal Secretary Susan Mochache has said that the money is intact at the Treasury and that out of 10 billion Kenya shillings, which the ministry had planned on spending through a commitment undertaking, only 2 billion shillings was used, as vaccines worth over 20 billion shillings have been supplied to the country to date by donors at no cost.
On 23rd of May, the Public Accounts Committee summoned Health Principal Secretary Susan Mochache on issues flagged by the Auditor General. The ministry had a budget of 16.42 million shillings to procure masks under the Transforming Health Systems for Universal Care project. Kenya Medical Supplies Authority (KEMSA) paid one supplier 250 shillings per piece. 3 other suppliers got 700 per piece for the exact same masks. Mochache saying the emergency caused the disparity.
I remember sitting here as a PS. You would not find masks. The counties are calling. Doctors don't have masks. We can't find masks. The US is buying from China. The whole of Europe is buying from China. We are buying from China. The supplier who is able to get the little brings that little and says, this is how much I'm selling. You are either taking it or leaving it. What do you give your people?
PS Mochache says the purchase of these masks was done at the very beginning, when the pandemic was causing havoc globally, not just locally.
Before the country could organize itself to have at least some bit of its own capacity, we were in a crisis. The audit report was for the financial year 2020, when the pandemic, 21, we were in the pandemic.
The Auditor General's report flagged the Ministry of Health's agreement to procure 10 million doses of the Johnson & Johnson vaccine at 10.96 billion shillings. Budgetary approval for the acquisition was 7.6 billion shillings, an overcommitment of 3.3 billion shillings.
If you know how commitments are signed, they are signed through approval by the National Treasury and the Attorney General, because they are not even binding to the Ministry of Health, they are binding to government. We withdrew what we paid the deposit. Then we started receiving donations. Now, would you go and make any more further payment when you have donations in your country? So we've not even been able to draw any more from this AVAT arrangement because we have enough doses.
Mochache says that under the agreement by the Africa Vaccine Acquisition Trust, the 10 billion shillings would ensure Kenya did not miss out on vaccines as countries scrambled for available doses. 2 billion shillings was used to purchase about 1.55 million doses, and thereafter donors started sending vaccines. She says the remaining 8 billion shillings is at Treasury.
The agreement said you must pay a deposit, and that is what the government committed. But for the Treasury to make sure that we received the vaccines, the entire money was put in the budget, but we didn't use it.
The Auditor General also flagged the Ministry of Health's use of 300 million shillings to procure Gavi vaccines without the National Treasury's approval.
Due to capping of procurement items in IFMIS, the ministry requested the National Treasury to uncap the item to enable the transfer of the funds. The uncapping of the item was done at the National Treasury, and the ministry was able to transfer the funds.
The report notes that 13 out of 20 ventilators purchased at the height of the pandemic at a cost of 59 million shillings or 2.95 million shillings each remained at KEMSA stores. The ministry blames this on the Ethics and Anti-Corruption Commission.
And again, it's a letter from the EACC to the acting chief executive of KEMSA, and the letter is saying, this is to request you to put on hold any procurement procedures and payments to the above entities until all investigations are concluded and or advised otherwise. So that is how the ventilators became part of it. That's why they remained in the warehouse and they could not be distributed as per the question that we are being asked.
According to KEMSA, up to 100 ventilators have since been distributed to several counties that include Kisumu and Tana River, among others. The World Bank is said to have funded the COVID-19 Health Emergency Response Project, with 53 psychologists hired to offer psychosocial support in various health facilities. A total of 49,400,000 shillings has been spent on salaries so far.
This support has been beyond the 20 million, because we even hired, psychologists under the COVID-19 specialists and posted them to all the counties and the referral facilities in this country on the payroll of the ministry to support the counties.
Mochache says the Auditor General's questions had not been raised by PSC members during a May 23rd session to clarify expenditures, and that some of the information required by the Auditor General's office was not readily available at the first instance of asking.
It is true that the financial statements indicated some misclassified items whose reasons are explained in the attached schedule in Annex 1. And if you go to point number 3 on the COVID research, it is said here that the funds were majorly used on research studies that were done on items to be later acquired. So again, this is an issue of accounting of books.
MOH and the government are working with USAID and other agencies to ensure transparency and efficiency at KEMSA. Nimrod Tabu, Citizen TV, Nairobi.
Let's now take you to the courts where High Court Judge